for our city. Thank you guys for being here. This is a wonderful, quaint gathering of our closest friends, and it is a big day for our city. And so we're here just to do some initial celebration. I'm a little surprised that we don't have more media here. You know, last week we did a press conference on the flu shot, where Mayor Stoney came and got his flu shot, and the room was full. And this is way more exciting than a flu shot. But I really want to invite our friend and leader, Mayor Levar Stoney, to make an announcement about why this is such a big day for our city.
Thank you, Danny. Everybody give Danny a round of applause, please. Now, I gotta say, Danny, like, you know, the flu shot happened to be like a couple of days before this past Saturday. And I guess if we just said that we're going to be talking about monuments here, they would all be here right now.
We'll think about
but today we're not talking about bronze and granite. Today we're going to talk about blood and flesh. And I am delighted to announce that Richmond will be the recipient of the Robert Wood Johnson Health Culture Award, one of 8 cities,
That's right.
which is a really, really big deal. Richmond, for quite a while now, has been working on change. You know, change requires action. And people like Dr. Avula, you're going to hear from Reggie Gordon, and others in our community have been working tirelessly for years now towards that change. Not just change that just lasts for a year, but for change that is going to be impactful. And that takes people working together across sectors. Public sector, private sector, the nonprofit world, our philanthropic community as well, working together to change people's lives. And you've seen that with the work through enhancing our after-school programs, extending transit to different neighborhoods, that unlocking the opportunities for folks to succeed. All of it comes together to create a culture of health. And so I'm very, very proud of our city. But I know that the work this is not the end of the work. Just because we win a prize, win an award, doesn't mean the work ends. We have to be even more courageous moving forward, even more bold moving forward. This is just a recognition of the work, what we can do and what we can unlock when we work together. However, we need to be even more audacious in our plans and our efforts to ensure that each and every child, each and every family really has an opportunity for success right here in our city limits. And here's the thing. I'm optimistic, and some say I'm always optimistic, but I'm really, really optimistic about what work we can do together with the recognition of organizations like Robert Wood Johnson, but also working with friends like Danny, having people like Reggie on board, and also, you know, all of you who have made it here today. So I am obviously delighted. I'm proud, but also I want to say the work continues. It does not end with today. We have a lot more to do, so let's go out and make it happen. Thank you guys so much.
A little bit of context about the Culture of Health Prize. Over 200 applicants, and Richmond was selected as one of 8 cities this year, cities and communities, to receive that award. And when Robert Wood Johnson Foundation, who's the largest health funder in the country, made their selection, the things that they're really interested in, or the things that really stood out to them about what is happening here in Richmond. One, that our conversation about health is one that thinks about health differently. It's not just, do we have an extensive healthcare system, and do people have good access to care? But it's this understanding that all of us in this room, I mean, I know almost all of you here because we work together on a really regular basis. This understanding that health is a function of a really complex interplay of a lot of different factors: education, income, family support, youth development. There's so many different pieces that contribute to whether a community is healthy or not. And the foundation, the Robert Wood Johnson Foundation, was really impressed by the degree to which people across sectors really understood that here in Richmond. And the second thing that really stood out to them was a commitment to having residents who are affected by decisions that government, that the philanthropic community, that institutions make, that residents more and more are being recognized as sources of deep expertise that needs to be valued. I just had a great conversation with Free about just the amazing expertise and wisdom that members of communities have. And so I think the Robert Wood Johnson Foundation was really struck by the way that we are beginning to recognize that as a community and beginning to find ways to honor and respect and compensate for that level of contribution and engagement. And one other thing that really stood out to them was the fact that we are making decisions that look different than other communities in this country. And one of those decisions is the commitment to poverty, recognizing that poverty is a major driver of poor health outcomes. And so our city has made a huge commitment to address poverty and has done that through the establishment of the Office of Community Wealth Building. So I want to invite my friend Reggie Gordon to come up and talk a little bit about the Office of Community Wealth Building and how it really ties into this culture of health that we're working on here in Richmond.
Thank you, Danny and Mr. Mayor. I have a few notes, but I'm going to follow their lead because this is something that's very personal to, I'm sure, everyone in this room. We have spent time, and thanks to our mayor and the administration of the city, and many of you in this room, deciding it's no longer business as usual in Richmond. And we need to work to form alliances and partnerships to create better pathways to economic mobility, health, and wealth for citizens of our community. It's important that we use a two-tier approach, a two-generation approach. Yes, we want to make sure that heads of household, adults, and parents have wages, livable wages, that allow them to provide for their families. But meanwhile, we need to make sure that all of our partners deal with early childhood and after school, aftercare, college, and career readiness. That has to happen simultaneously so that the whole family is able to thrive. That's exciting. It's a new day in RVA. And let's face it, historically, we probably haven't lived in a community where everyone had the opportunity to thrive. And we sort of expected people to be there for our services. And we parachuted in and provided services. But what's different about this and what this affirmation from the Robert Wood Johnson Foundation proves is that when you incorporate the voice of many people and have them at the table as they create their new future, that's what's exciting. Congratulations to all of us. This is a good time for us, and more importantly, this is transformative and an important inflection point for the citizens of Richmond. Thank you.
I'll close with this thought. I've gotten like 150 emails of congratulations today, but this prize really has so little to do with me or even what we as a health department have done, although certainly the folks in the health department have contributed to a culture of health. The reality is that all of you guys, the people in this room, the partners that we share with, the communities that we serve, there is something happening here in Richmond that is contributing to this journey towards a culture of health, and it's a really exciting time. So we do see this as a recognition of what's happening, but also the beginning of a new way of doing business, as Reggie said, and really invite all of you to continue to do that work with us. So thank you for being here. Thank you for celebrating with us. This will not be the last you hear about the culture of health. There will be a number of activities and articles and then a deepening of the work that has already been started here. So thank you, guys.
Folks,